Coffee is one of the most popular methods for consuming caffeine, and 64% of Americans consume at least 1 cup of coffee per day. There are many myths that surround coffee drinking, and many people don't know what the true effects of coffee drinking really are. This brings us to the question, what do we know to be true about the effects of coffee drinking on various aspects of health? Let's meet some people that are concerned about their consumption of coffee and what it can mean for their health. Myth number 1, coffee drinking increases risk for cardiovascular disease. Meet Anna. She has a family history of cardiovascular disease and is worried if her coffee consumption may be increasing her risk for developing a condition. Moderate consumption of coffee up to 400 milligrams has been linked in several studies with a lower risk for cardiovascular disease, controlling for other confounding variables such as smoking and sedentary lifestyle. However, caffeine has been linked to an acute increase in adrenaline and high blood pressure with non-regular drinkers. These effects do subside after regular consumption of coffee within a week. Additionally, caffeine from energy drinks combined with alcohol consumption and physical exertion has been linked to cardiovascular events. Hypertensive patients need to be particularly careful. Interestingly, how caffeine affects you depends on what version of a specific gene called the CYP1A2 gene you have. This gene codes for an enzyme that metabolizes caffeine. It comes in 2 versions. Those with the slow gene break down caffeine slowly, and those with the fast gene break down caffeine quickly. So if you're a fast metabolizer of caffeine, drinking up to 2 to 3 cups has been linked to a lower risk of having a heart attack. But if you're a slow metabolizer of caffeine, drinking 2 to 3 cups has been linked to an increased risk of having a heart attack, which increases further with increased consumption. So, what type of metabolizer are you? Slow metabolizers can get jittery and stay wired up to 9 hours after drinking caffeine. Meanwhile, fast metabolizers simply feel more energetic and alert for a couple hours. You can always use a genetic test to confirm what version of the gene that you carry. So, what are some of the recommendations for Anna to lower her risk for cardiovascular conditions? Moderate habitual consumption of caffeine has been linked to lower risk of cardiovascular disease. And if she's a slow metabolizer, she may want to eliminate or reduce high episodic consumption of caffeine and drink coffee keeping her gene type in mind. Myth number 2, coffee drinking is bad for anxiety and your overall mental health. Meet Rachel. Rachel starts every day with a cup of coffee. She credits her morning coffee with helping to kickstart her mood, bring focus to her work, increase her overall productivity, and ability to socialize with her coworkers. Lately, Rachel's workload has been extremely stressful, and she's been drinking more coffee to stay on top of her tasks. Her husband notices that she is more restless and irritable, and he worries that Rachel's coffee drinking may be causing her anxiety symptoms. Her relationship with coffee echoes the experience of countless coffee drinkers worldwide who insist that a cup of coffee daily contributes to a more balanced, positive mindset. In fact, evidence suggests that consuming small amounts of caffeine from regular coffee drinking can actually increase a person's mood, motivation, attention, and confidence by increasing the production of dopamine and adrenaline in the brain. Furthermore, there are studies correlating the caffeine in coffee with improving the efficacy of certain mental health prescriptions. Caffeine has also been helpful in relieving and protecting against depression, and even shown as a useful coping tool to manage symptoms for those with undiagnosed ADHD. However, Rachel's husband has some reason to worry. Ultimately, consuming caffeine in coffee can affect people's mental well-being differently based on their age, genetic factors, and caffeine tolerance. Rachel can certainly worsen her anxiety symptoms by overindulging in coffee drinking, as too much caffeine consumption takes away from the positive effects that Rachel wants out of her morning coffee, and can actually cause more harm by inducing jitters and feelings of anxiousness or irritability. Caffeine consumption greater than your normal limit may even bring coffee intoxication, a negative mental health state described in the DSM-5 that brings anxiety symptoms, agitation, headache, rambling speech, and excitement. So, does coffee drinking really bring poor mental health and anxiety? No, not necessarily. Although Rachel may be feeling more anxious due to her increasing her coffee intake, coffee is not universally harmful to one's health, and everyone has different limits for consuming caffeine. In small and regular amounts, coffee drinking can actually boost one's mood and mental health, but ultimately it is up to the individual's discretion to balance their caffeine consumption so that they can experience its proposed mental health benefits and avoid any negative effects that can come from overconsumption. Myth 3. Coffee drinking induces insomnia. Meet Samuel. Samuel has insomnia, which means that he is often unable to fall asleep and lays awake most nights. Samuel has started to wonder if there are any factors that contribute to his insomnia, and many of his peers have told him that his frequent coffee drinking may be one of the initial causes of his insomnia. So, Samuel is having concerns about his coffee drinking that is potentially causing his insomnia. The answer to his question all comes down to how much caffeine he's consuming on a daily basis and how close to bedtime he's consuming his last cup of coffee every day. Caffeine alone cannot cause insomnia, but rather the overuse of caffeine can lead to the onset of insomnia symptoms or the worsening of pre-existing insomnia. For most adults, the recommended caffeine consumption amount is 400 milligrams. It's important to stay within this recommended amount, especially for someone like Samuel who is experiencing insomnia. Caffeine has also been proven to disrupt your body's natural circadian rhythm or your natural sleep cycle if ingested too close to bedtime. It's recommended to consume caffeine at least 6 hours before going to bed every night. So, as long as Samuel consumes coffee 6 hours before bedtime, there is an unlikely chance that he will experience the nocturnal effects that come with caffeine ingestion. Consuming caffeine 6 hours before bed has been seen to reduce sleep time by 1 hour. So, what does this mean for Samuel? Does he have to stop drinking coffee to manage his insomnia symptoms? Thankfully, Samuel can use this new information to modify how much coffee he drinks and the time of day when he consumes his coffee, so that it is ingested in a healthy amount and does not exacerbate his insomnia. This myth is not true, as coffee drinking does not induce insomnia, but can lead to the onset of insomnia if consumed heavily or incorrectly. Myth number 4. Coffee drinking can stunt growth. Aaron here is a high school student who uses caffeine to stay awake for his classes. Aaron worries that drinking coffee at his age is going to stunt his growth because he heard that drinking caffeine at a young age can have those effects. Although there have been multiple studies on the effects of caffeine and growth of children, there have been no significant supporting evidence for skeletal stunting. However, it is important to note that caffeine does act as an appetite suppressant. Caffeine has the effect to make one not feel as much hunger after consuming. This means that you may not feel like eating after drinking coffee, but not because you're full, but because your body doesn't send the hormones to create the hunger feeling. Eating less can lead to a lower amount of daily calories consumed, and your body may not have enough nutrients to grow sustainably, and this may include overall weight loss. So even if there is not linkage between caffeine and growth stunting, it's important to assure that one is eating before drinking their coffee in order to give yourself enough nutrients to grow. Myth number 5. Coffee drinking is unhealthy. Through meeting our coffee drinkers and investigating the many coffee drinking and caffeine myths, we know that there can be many benefits to coffee drinking and it is not universally harmful. In fact, studies have shown that coffee drinking can actually be linked to longevity for humans, and that 2 to 3 cups of coffee a day is correlated with an increase in markers for better cardiovascular health, mental well-being, and a longer lifespan. Qualitatively, caffeine can boost our mood, alertness, sociability, memory, and reasoning skills, and coffee has many antioxidants that are beneficial for our health and cancer prevention. The potential benefits of caffeine is still an ongoing field of research, and